Families are beating the heat by hitting the water this summer, but no one wants all that time at the beach or in the pool to add up to swimmer's ear. In today's Healthy Habits with Dr. J, founder and CEO of High Level Speech and Hearing, Dr. Lana Joseph Ford is offering some tips to help us prevent swimmer's ear. Welcome back, Dr. J.
Thank you so much for having me again, Malik. I'm happy to
Of
be here.
course, and I am glad we are talking about swimmer's ear. This is something that we've actually talked about before, but because we're in a new season, it is important that we talk about it. For those of us who still don't know, tell us what swimmer's ear is.
Sure. So, swimmer's ear is a bacterial infection of the ear, and it is really, really important that we are aware of the fact that it can happen as well as know what we need to do to prevent it. So, I see a lot of this in my office. I'll see kids come in, and the parent will say, "Oh man, little Billy, little Johnny, they went swimming in the bayou," because we do that here in Louisiana. So they went swimming in a bayou, and unfortunately, they got an infection in the ear, and now it's all nasty and grimy on the inside. A lot of times, that is a result of a bacteria getting right into the ear because the water is unclean.
Very interesting. Is there a specific part of the ear that gets infected? We have a visual here that we want to show everybody.
Yes, yes, yes. So it is actually an external ear infection. And what that means is inside of the auditory canal, there is bacteria that gets down in there and it causes all of that tissue and skin around it to get infected or inflamed due to the bacteria getting in there. And I mean, just as it is an external type of infection, it is treatable and there are ways that we can reduce your chances of getting it.
Well, let's talk about some ways to treat it. You actually have brought us some home remedy tips that we can do, obviously at home, to help alleviate this condition. What do you suggest we do?
Yeah, yeah. Y'all know typical New Orleans fashion. We all about some type of home remedies, right? So, absolutely, one of the things that we see a lot of, and you'll hear it like the old people would say, right? The old schoolers in the room, they would say to drop a little bit of vinegar into your ear. I've also heard a little bit of rubbing alcohol and also warm olive oil. Now, I'll say this. I have not done any of those, and I do not recommend that you do any of those at this time. First, you should always reach out to your doctor. Go to your primary care physician, ask them if this is a true swimmer's ear infection first before you do anything. And then, secondly, they'll typically prescribe you some antibiotics in hopes that it'll go away. But these are some remedies. They'll put a little bit of oil, put a little bit of vinegar, put a little bit of alcohol, and it's supposed to dry the bacteria up. But you know how that is, though.
Very interesting. And is there something that you maybe see with your patients that they do to help treat swimmer's ear that you don't suggest because it's kind of like an old wives' tale, you know?
Oh Lord, Malik, where do we start with this one? I've seen all kinds of things happen. I've seen people put cotton in their ears. Y'all do not put cotton in your ears. I've been telling y'all that since last year. Don't put cotton, don't put Q-tips, anything inside of your ears. But people are doing it anyway. I don't recommend it. Go see your primary care physician. Let them tell you what to do, and they'll knock that swimmer's ear right out.
And we're talking about ways to treat swimmer's ear, this morning, but honestly, the best way to not get swimmer's ear is to prevent it. How do we prevent getting this condition?
Yes, sir. Definitely prevent it by doing things that are so easy to do, like don't go swimming in the bayou. I'm sorry, don't do that. Swimming. If you're going swimming, swim in clean water. That's the first thing to do. A couple of other things. If you know that you have some type of cut or bruise in your ear, don't go swimming because it can get infected. When you have an abrasion that tears skin cells away, that means you're leaving an open wound. And anytime bacteria comes in contact with the open wound, that's not a good thing at all. Also, practice good post-swimming ear hygiene, meaning make sure that once you get out of that water, you're drying your ears out. And finally, my favorite thing to do, get you some custom swimmer's molds. At High Level Speech and Hearing Center, we do them all the time. It's really easy and it's not expensive at all. So get you some custom swimmer's molds, put them in your ears, and hop in that bayou if you want to.
And I'm curious, Dr. J, is there like a sign or symptom we should be looking out for? Because when I think of going swimming, right, and I think of water in my ears, is that a sign that we might be getting swimmer's ear because we're letting that water sit in our ears for so long?
That's a good point. That's a good point. So, I wouldn't say that it's a sign of you possibly having swimmer's ear, but it could lead to swimmer's ear if you're leaving that water in your ear for a long period of time. Again, the best treatment for it is to make sure you're drying your ears out, don't swim in dirty water, and make sure that you get custom earplugs to protect your ears from getting any water inside of
And
them.
the best way to get the water out of our ears, my mother used to say, just lay on your side. Do you suggest that as an audiologist as well?
That's right. Dump that water right out. Lay on the side and knock that water right out of your ears.
There you go. Some great tips this morning. Dr. J, thank you so much for joining us as always. And hey, if you would like to set up an appointment with Dr. J, she has two high-level speech and hearing locations, one in New Orleans on Magnolia Street, the other is in Harahan on Jefferson Highway. To set up an appointment, you can call 504-345-2984 or check out her website, highlevelhearingnola.com.